How should you study for pharmacology? So I know everybody's on Christmas break or winter break right now, or most everybody is. But if you are going to take pharmacology in your nursing program at some point, be sure to bookmark this video right here. I came up with an acronym, MONEY, M-O-N-E-Y, to help remember where to focus your studying for pharmacology specifically. So the M stands for memorize. Pharmacology is basically the only course in nursing school that I say to memorize, but what we're going to memorize is drug classes, not every single individual drug. So for example, antihypertensives, that's a very broad class, right? So let's think about beta blockers specifically. What we're going to memorize about the beta blocker is a very, very simple mechanism of action. So the very, very simple mechanism of action of beta blockers is that they block sympathetic nervous system stimulation of beta receptors. So what does that mean? That means they are going to cause a decreased heart rate, a decreased blood pressure, vasodilation. So the O stands for outcome. What do we want the outcome of this medication to be? So if it is a beta blocker that we're giving for hypertension, we want the outcome to be lower blood pressure. So our N stands for the negatives. So the side effects and adverse effects of the top drug classes. And we're only going to talk about maybe 1 to 5 at the most. So let's look at beta blockers. And one of the top things that I see students doing is overlooking the obvious. So with beta blockers, we want our outcome to be lower blood pressure, right? So what would be a potential negative or adverse effect of a beta blocker? Well, it could go too far and cause hypotension. Going back to our mechanism of action, we know that beta blockers can drop the heart rate. So bradycardia is another potential negative of beta blockers. Third, we know that they block sympathetic nervous stimulation of beta receptors. There are beta receptors on the lungs. So a big negative, potential negative of beta blockers is bronchoconstriction. So next is E, and this stands for evaluation. And this is probably the largest category in our entire MONEY acronym. So evaluation encompasses all of the things that we're going to do as nurses to protect our patient. What do we need to assess in our patient before giving the drug? How do we need to plan to intervene if that patient experiences negative side effects? What are we going to teach our patient if they are newly prescribed this drug and they're going home or being discharged on this new drug? So back to beta blockers. What will we assess before giving the drug to ensure that our patient is safe? Well, again, don't overlook the obvious. Heart rate and blood pressure. What if that patient's heart rate is already 48 and their blood pressure is 90/50? It's not safe to give the beta blocker. So bronchoconstriction. We need to assess the patient for a history of COPD or asthma that would make them more susceptible to bronchoconstriction after receiving a beta blocker. So patient teaching. What will we teach a patient newly discharged on a beta blocker? Well, we're going to teach them how to recognize those negative effects that are occurring. So what are the negative effects? Bradycardia, hypotension. Usually orthostatic hypotension would occur before just flat out hypotension. So we're going to teach them to watch out for dizziness when going from sitting to standing. We're going to teach them to report feelings of dyspnea or shortness of breath or lightheadedness. So the Y stands for YouTube, and specifically there's a YouTube channel and it's called Pixarise. And it's specifically designed for visual learners that are taking pharmacology. And it just really highlights the most important side effects of drugs that you need to learn. Bonus tip, drugs that have levels, say like vancomycin. we draw peaks and troughs on vancomycin. Why? Because if that drug level builds up to toxic levels within the body, it can cause major problems, renal failure, things like that. So any drug that we draw serum levels on, it is very important to understand why and what can happen if the levels are too high or toxic for that drug. Also, drugs that are teratogenic, meaning they can harm a fetus in a pregnant woman, like ACE inhibitors. You better know that. Finally, drugs that can cause severe allergic reactions, i.e. antibiotics. Be sure you know that and know the early warning signs of allergic reactions. One more bonus tip, I really love the Made Ridiculously Simple books. They have these for pharm, they have these for pathophysiology, and they're about $19.99 on Amazon. Hope that helps you guys. Enjoy the rest of your winter break if you're out right now, and have a very Merry Christmas and go Vols.